I'm Brian Lynch and I'm Head of Communications and Advocacy with Arthritis Ireland. For me, the course represented a real opportunity to be able to invest in our advocacy work and to be able to enhance what we're doing there, particularly around the area of access to medicines and understanding that process. There are a lot of therapies that are available for people, particularly living with inflammatory arthritis, and there are new treatments coming through all the time. So we wanted to be able to enhance our work in representing people to make sure that they have the most equitable and greater degree of access as possible. There certainly is a lot of material to digest, and I suppose particularly in areas maybe that might be less familiar to a student. I hadn't studied science in a long time, but what I found was that the way the course is structured, those earlier modules allowed everything then to build up for the later material. And I was also coming with it from the point of view, there's certain things I wanted to know, things I wanted to get better at. So I was able to focus more attention on those. And then the fact that the course is delivered kind of, on a modular basis, I was able to come back to it at a time that suited me. The quizzes were open throughout the modules. So that all suited a kind of that online learning format. Completing the course coincided with an ambition we've held for a long time in Arthritis Ireland, which was to get patient input into health technology assessments. So when new drugs are approved and then they're being assessed by the NCPE, the National Centre for Pharmacoeconomics, as to whether they're going to be reimbursed, we wanted to put patient panels together around all of that because the NCPE is broadening. So having completed the course gave me a much greater grounding in how we might go about that, the different types of roles that patients might fulfill. And the response we've received so far has been really encouraging. And that certainly kind of is testament to the course itself from my perspective. Understanding clinical trials was a huge thing, and being able to get a grasp on the various phases of those, and even as well in terms of how patients might get involved in that, because that clearly is a huge part of our remit as well. Because unless we have patients supplying data and on these trials, then the whole process of getting Irish data as part of these approval processes ultimately slows down. So in many ways, I think some of the benefits that have accrued from the course, maybe I didn't anticipate them at the start, but hopefully they will definitely enhance and improve our performance as an organisation.